Hello, this is Ron Paul with your weekly update for Monday, September 6th. Cook County, Illinois Judge James Shapiro reached a new low in COVID tyranny by forbidding Rebecca Firlit from seeing her 11-year-old son until she receives a COVID vaccine. Judge Shapiro is not alone in abusing judicial power to force individuals to get vaccinated. Judges across the country have ordered defendants to get COVID vaccines, sometimes as a condition of avoiding prison. This outbreak of judicial tyranny is a symptom of the authoritarianism pandemic that is the real threat to America. Corporations are imposing requirements, including that employees show proof of vaccination, pay more for health insurance if they have not had a COVID vaccine, and undergo regular, if some cases weekly, COVID tests. And increasingly number of state and local governments are requiring their employees and even people working in some private jobs to take COVID vaccines, as well as imposing vaccine passport requirements on people generally. President Biden has urged employers to implement vaccine mandates, and government is working with its big tech allies to develop model vaccine passports. Government-approved model vaccine requirements, combined with government officials encouraging their adoption, send the message to businesses that imposing vaccine requirements on their employees and maybe their customers as well is a good way to stay in the politicians' and bureaucrats' good graces. An effective way for the U.S. government to encourage adoption of vaccine mandates and vaccine passports is denying federal funds to businesses, states, local governments, and other institutions that refuse to require employees, customers, or other people to prove they are vaccinated. This will result in vaccine requirements while enabling governments to claim it is not forcing vaccines on anyone. President Biden is already planning for the United States government denying Medicare and Medicare funding to nursing homes that do not require their employees to prove they are vaccinated. This could result in a staff shortage at nursing homes. A short-staffed nursing home poses a much greater risk to residents than nursing homes with a staff comprised of healthy, unvaccinated individuals. Texas has experienced a nursing shortage thanks to, in part, to hospitals firing unvaccinated nurses. Healthcare workers have good reason to resist vaccine mandates. Many individuals have died or suffered other adverse effects, including miscarriages after receiving a vaccine. Some people try to justify vaccine mandates and vaccine passports by saying that by risking infecting others, unvaccinated individuals endanger other people. However, the Federal Center for Disease Control recently admitted that COVID vaccines do not prevent the spread of infections. In addition, the claim that we are having a pandemic of the unvaccinated relies on data collected from early in the year, before many Americans had taken COVID vaccines. It is imperative that we support the growing resistance to vaccines, mandates, and vaccine passports. We must also expand the resistance to COVID authoritarianism